Hey, welcome. This is Thrive Health Systems East location, and I'm Dr. Erik Arter. I'm the Senior Physician and Clinical Director here, and I want to go ahead and invite you to take a little tour with me through my clinic so you can know what your patient experience will be like as you come, and also to get to know some of the services we offer here. Here we do a multitude of treatments for a multitude of conditions. We jokingly say that we're holistic doctors because we take care of a whole list of problems, and that's not far from the truth. Now, areas ranging from musculoskeletal conditions to nutritional and functional medicine issues. All of that starts right here with your new patient consultation and exam. Now, we do a lot of discovery here. In this room, we'll do orthopedic testing to figure out what's going on with you, to diagnose the condition, and to get an idea of the areas of dysfunction. And we have some very cool tools here. One of those is digital x-ray that allows us to get below the surface to find out if the areas you are dealing with that are painful are due to posture or degenerative disorders. We can find out how the spacing between the discs and vertebrae are. And again, all of our examination starts here. This is where we're going to talk for the first time, get a detailed examination, and find out the roots to your problem. From here, I want to take you into another room. This is the room we call the Report of Findings room. And it's in here that we'll get to talk about what we found in our examination. We review the items of our consultation, and we also go into a lot of nutritional counseling in here as well. Now, functional medicine is the art and science of getting to the root cause of conditions that you may already be seeing your doctor for. We do the nutritional side of diabetes, heart disease, obesity, autoimmune disease such as Hashimoto's or MS, lupus. We also do the nutritional side of metabolic syndrome and leaky gut. And you'll see here we've got a wall of our case studies, and again, this is for our patients to review while they wait for the doctor to come in. And we've had success in areas ranging from depression, migraines, thyroid, prostate, sciatica. And this is an opportunity for you to get to know us on an even deeper level, because you get to hear from our patients and not just us. Now, I want to walk you down the hall here. This is a very unique room. This is our laser and decompression suite, and this is where we do a lot of therapy for back issues, things ranging from disc herniations, even the neck or in the low back, facet syndrome, sprains and strains. Now, this is a table we use to decompress the spine, and this tool here is called a class 4 laser. This is where we would use it on anything that needs to heal faster. That may sound kind of like a funny statement, but we use this to speed up the mitochondria and to sweep inflammation out of the area. So if you've been dealing with chronic pain, whether it's a disc or a facet that's inflamed, or arthritis that's been chronic, or even a muscle strain or sprain, this laser actually penetrates 3.5 to 4 inches deep to speed the process of healing up by speeding up the mitochondria and pushing inflammation out. It is nothing shy of a miracle. It is a wonderful tool, and we're blessed to be able to use it. We actually took it about a decade and a half ago from the veterinarian world, where they had been using it for decades for horses and dogs for very similar treatments. Now we use it on humans, and it's very effective. Now, one area in our clinic that a lot of our patients ultimately end up utilizing is the gym. Now, we're very blessed to have the space in this office to do something called functional movement training. Now, functional movement training is a different perspective on the body than, say, physical therapy. It's in here where we will compare your original x-rays to your final x-rays to show changes in the spine. A lot of our patients will step in here having problems for a decade or more. And anytime that happens, posture is going to be affected. Whether it means you've lost the curvature in your neck and you're in stage 2 or 3, and heaven forbid, stage 4 degeneration, we want to make sure that we take those patients. And this is, again, several patients that we like to hang on the wall when we've had success, where the neck has been very straight, a loss of curvature was present, and we were able to resume that and totally reverse the issue. Spinal changes in the low back, in the thoracics, where somebody's got a kyphotic curvature, where they've noticed they've started to get what's called a Dowagger's hump on their back, or a neck that's just causing so much pain in the upper back because they're leaning over the computer all day. This is where we make those changes. Now, you'll notice in this office, or in the FMT section of our office, there's not a lot of tools, and not a lot of machines, I should say. This is not your typical gym. You'll be working one-on-one with a functional movement specialist who's going to crack the code to getting your posture back, to actually opening up areas that have been too tight, activating muscles that have been inactive or deactivated because of certain conditions in the body. In here, this is where we do a lot of our stretching. There's a lot of hands-on work here, And we even have a machine here where we make custom orthotics for your feet that go into your shoes, so we can change things from the foundation up. Many people wonder why one hip wears out before the other, or one knee wears out before the other. It has to be replaced. Much of that can be solved by addressing these issues early on. Sometimes that's an issue of the feet, sometimes that's an issue of the spine, sometimes that's even an issue of the upper cervical spine and neurological imbalance. Today I want to take you, just to finish our visit here, into some of our treatment bays so you can see what kind of therapies we utilize here. We do have a couple of very special tools that we use for adjusting the spine. I'll take you into one of our adjusting bays here so you can get a feel for what the space looks like. We have 3 of these rooms, they're identical. And one of the tools that we use here, this is called an Arthrostem, and this is to adjust the spine when maybe there needs to be a little bit more finesse, or maybe we need to be a little bit more gingerly about an adjustment. Again, this is very gentle, okay? These tools are very valuable to the patient who doesn't like traditional adjustment means. We also do some very special treatments here called upper cervical, where we're addressing the upper cervical vertebra, and we have special instruments for that. I'll show you that in a second. So let me go ahead and show you another room. We'll talk a little bit about our upper cervical treatment. All 3 of our doctors here are trained in upper cervical therapy. And it's a blend of orthospinology and atlas orthogonal treatments. This tool here is a very light adjustment. It looks a little scary, but it's very, very accurate, very light. And what it does is it adjusts the upper cervical spine, the atlas bone, right underneath the skull. Now, if you've had migraines or headaches, or even have kind of chronic shoulder pain, this is probably the treatment for you. Also, if you've had low back problems or knee problems or hip problems, a lot of that can come from the neurological imbalance that stems from your atlas bone being off kilter. One of the very unique things that we do here is we assess the spine in a way that really not very many doctors in Colorado do. There's only 5 of us that are trained in this method. And what happens is an x-ray analysis of the bone at the very top of your spine is taken into consideration, and a lot of physics and math is done to assess what angles we need to use to get that to rectify. We've had patients who've come in with digestive complaints, sciatic issues, knee pain, feet pain, eye issues and vision problems, vertigo and dizziness, that have responded very well to this treatment that, again, like I said, is not offered in most places. So we'd like to invite you to come into our clinic, get an assessment, and find out how to get your life back. Now, like I said, we'll start with a detailed examination and find out what your problem is, give it a name, diagnose it, and map out a plan to get you back to where you need to be. Somewhere on this page is a location where you can click and get a new patient consultation. And what it'll do is it'll link you to an offer that is a $19 offer to come in, sit down with myself, get a detailed evaluation, and again, map out a plan to get your life back. Again, I'm Dr. Erik with Thrive Health Systems, and we hope to see you soon.